My name is Robert Reedy, and I'm the Senior Director of Vocational Services at RISE, where I've worked for the past 20 years. In that capacity, I oversee 3 individual placement and support programs in Hennepin County and Anoka County. Additionally, RISE operates 2 IPS projects in central Minnesota, serving 9 counties. RISE also participated in 2 Social Security research projects, testing the effectiveness of IPS services. I oversaw those efforts and worked directly with the research team. In our IPS projects, RISE has worked with over 2,000 Minnesotans in 18 years, and I can attest to the effectiveness of the model. IPS is an evidence-based practice in the area of employment for people who experience mental illness. IPS service have been shown over and over to be the most effective way to deliver vocational services for this population. Why is this important? Because work works. Federal Substance Abuse and Mental Health Services Administration, SAMHSA, recognizes that employment is an essential part of recovery from mental illness. This is something that we see every day at RISE. And as you will hear from Daniel shortly, without the funding in this legislation, current projects will be cut by 27%, including projects at RISE. At our organization, that means that we will serve 73 fewer individuals in the next year. In addition to preserving services, the increased funding in this bill would allow the program to serve 325 more Minnesotans with mental illness. The increased access to IPS services throughout Minnesota is a critical need. Currently, only half of the counties have any access to IPS services. RISE's IPS program is the only one in Hennepin County, the most populous and diverse county in the state. Obviously, the needs are much greater than we can meet today. This additional funding could allow an expansion to more geographic areas and extend services for individuals who are Black, Indigenous, and people of color. I can personally attest to the effectiveness of work in recovery. On April 15, 2021, my son died from fentanyl poisoning. This loss, as you can imagine, was devastating. My mental health was profoundly impacted, and work was a critical part of my recovery. Having a sense of purpose and a place to be amongst people that supported me were an essential part of my path to healing. I was fortunate. I had a job. I had a support system in place. But there are many Minnesotans with mental illness that do not have a job already and rely on the support provided in this bill to access the benefits of employment. Work works. It has for me, for Daniel, and we need to make sure IPS services remain available to people across the state who need the services most. We need to make sure that Minnesotans who experience mental illness have the opportunity to work as part of their recovery. IPS programs make a difference, but we need to fund them. Please support the ongoing and additional funding for individual placement and supports in Minnesota. Thank you.